Well, one of the reasons I chose Susquehanna Health was the community here. I come from New York City and I have a family and I have a small kid. I feel that it's a small town and everybody's like a big family. I really like my neighbors. In fact, I live in Williamsport and all my neighbors and we are like a big family. We interact. It seems to me that because of the small town, everybody knows everybody. So, I get to it has happened to me that I get to see my patients in a supermarket and there's this feeling that really feel welcome in this town. And my own family doesn't live very far from here, so that was an added plus. The way Susquehanna Health has helped me transition into my new position is that initially when I started, I was made to feel very welcome. I had no problem initially in meeting new people, and people were very helpful. We work here as a team, and I think my transition was seamless. The thing about my job which inspires me the most is that I get the privilege to take care of patients. Every day brings a new challenge. The patients that I see here have a variety of pathology, and the privilege that I get in treating them and the satisfaction that I see on their faces. The other thing which inspires me the most is that I get to work with a team of people who are like-minded and who have the same objective as me in treating the patient and putting the patient the foremost. The way I would define excellent patient care is putting patients first. So my or anybody else's priority here at Susquehanna Health is putting patients' interest and care first, to go the extra mile to care for the patient, to speak and coordinate their care with other medical professionals, and to put patients' interest before anybody else's. To describe a moment when I made a difference in a patient's life was, in fact, very recently when I was on call. I had this call from the emergency room about a patient who was bleeding. In fact, the patient was vomiting blood and was also dropping his hemoglobin. The patient needed an emergent endoscopy. In fact, we were able to come in, we were able to do an endoscopy. We were able to localize where the patient was bleeding from, and we were able to stop the bleeding. And I felt at that moment that I really made a difference.